Thank you, Keith, and good morning, everyone. I'm Murray Ross, Director of the Kaiser Permanente Institute for Health Policy. I have no disclosures and no directions to give you, so you've got all you're going to get. But I wanted to welcome everyone to today's forum on leveraging telehealth to expand access to high-quality care. For almost 20 years, the Kaiser Permanente Institute for Health Policy has worked to shape policy and practice with the evidence and experience from our innovative finance and delivery system at Kaiser Permanente. In support of that mission, we initiated this 2017 Health Policy Forum series. At these events, we convene experts to share knowledge, spark discourse, advance collective thinking on topics of critical importance. Last month, we had a session here on mental health and wellness. We have a number of events planned for 2018, and then we're really looking forward to today's event. We're going to spend a lot of time today talking about practicing medicine in the 21st century. We'll consider the drivers of new models of care, the emerging evidence, and identify where we need more evidence, and explore the policy and operational challenges to broad adoption of telehealth. I want to thank all of you for taking the time to spend with us, to contribute to the discussion. There's so much we could talk about, but before we do that, I want to offer one general thought, and that is, the questions we ask determine the answers. That's not as profound as that pause would lead you to believe. The point is, far too often our discussions tend to hone in on pretty narrow details. It's return on investment for telehealth or concerns about increased provider workloads. These are important issues, especially to those who are paying for the investments in infrastructure and to payers and policymakers. But we need to broaden our thinking to address other considerations, such as the impact of telehealth modalities on the populations we serve. And if we think narrowly, our solutions will be narrow. So today I want us to expand our thinking and push ourselves to get interested in some things that maybe we haven't focused on before. Be curious, be inspired, and ask different kinds of questions. Appropriate to these times, John F. Kennedy once said, "Too often we enjoy the comfort of opinion without the discomfort of thought." And I'm going to challenge us today not to do that, but to stretch ourselves to think in new and innovative ways. Today's conversation is really about driving innovations that advance care, transform the patient and member experience, and improve quality. So one of the purposes of these forums is to leverage our collective brain trust that helps all of us formulate the right questions. We have an event hashtag, which should be on your tables and is up on the screen and in the agenda. We encourage you to share your thoughts and to make connections with one another on social media and to your social media networks. So with that, I'm going to take a little bit of the moderator's privilege for a moment and talk about some of the things that we at Kaiser Permanente think about often. First, and I think many of you, maybe all of you already know this, with technology moving at a rapid pace, consumers expect convenient ways to access healthcare as they do with other industries. We're all used to booking flights, travel, hospitality, financial. We do our banking on our phones. I think it's safe to say there's a growing recognition and acknowledgement among providers and delivery system leaders and even policymakers that leveraging technology to augment care holds promise and maybe is even essential. Second, we would argue that that promise is best realized when technology-enabled care occurs in a coordinated manner. In our system, telehealth options are simply an extension of our integrated care, not an extra service you have to add on. And as many of you know, Kaiser Permanente has a long history in this space, providing secure email and phone visits long before other providers. Included in our telehealth portfolio are also things like doctor-to-doctor consults and video visits. So here's some things we've come to know. First, when telehealth is treated as a product or a one-off service, the patient probably won't know much about the physician, and the physician won't know much about the patient. They'll only know what's discussed during the consult. In the Kaiser Permanente model, oftentimes issues are resolved during the telehealth visit, whereas with third-party solutions, consumers may be encouraged to follow up with their primary care physician, leading to unnecessary visits. When our telehealth capabilities combine with a connected system, patients may benefit from reduced diagnosis and treatment time. Inside Kaiser Permanente, the technology enabling doctor-to-doctor consults can help save lives and speed up the whole care process. Our telestroke program is a great example of this. This program, and there's some material in your brochures or your packets about this, is available in where we operate in California, Oregon, and Washington State. And it's addressing the long-standing challenge of reducing lag time in treating strokes. By employing mobile video technology in emergency rooms, we're enabling stroke patients' treatment to start sooner, saving precious minutes in the ER, preserving brain function, and saving lives. And again, you can learn more about that in the materials in your folder. Also, demand from our members is growing. They want to interact with us via different modalities, such as telephone, video, and secure messaging. The majority of our outpatient interactions are now happening through these modalities. And since 2012, across the entire KP enterprise, our members have had more telehealth touches than in-person visits. To move the needle forward, we need a collective voice on these and other public policy issues. We need others to speak up about their experiences leveraging technology to advance care. Recognizing that policy will play a critical role in identifying viable solutions, we need all the perspectives represented here today: federal, state, employer, researchers, providers, advocates, wonks, end users, to inform and advance the dialogue. So I thank you all for being here, and I look forward to your active participation during the meeting. And now, without further ado, it's my absolute pleasure to introduce our morning keynote speaker, Dr. Helen Burston. Many of you know Helen in her role as Chief Scientific Officer of the National Quality Forum. You may know her from her previous role as the Director of the Center for Primary Care Prevention and Clinical Partnerships at AHRQ. She is now, I guess, sort of officially at the beginning of January, assuming the role of Executive Vice President and Chief Executive Officer of the Council of Medical Specialty Societies. CMSS and its 43 member societies represent almost 800,000 physician members in the United States. Dr. Burston is the author of more than 90 articles and book chapters on quality, safety, and disparities. She's a professorial lecturer in the Department of Health Policy at George Washington University School of Public Health and a clinical associate professor of medicine at George Washington University. Immediately following Dr. Burston's presentation, we will jump to a reaction panel facilitated by my colleague Keavney Klein, and then Dr. Burston will come up and be able to answer questions at the end of her presentation. So thank you all, and Helen.